Welcome to the Evolution Show. Today, I'm going to take a big picture view at the pandemic, the coronavirus crisis. What can we learn when it comes to emergency readiness? How is it that different countries are very unprepared to this health crisis? I'm going to take a closer look at Sweden and other countries. Sweden used to be one of the world leaders when it comes to emergency readiness, but today it is one of the most unprepared countries in Europe and the rest of the world. I'm also going to show why it's vital to understand the power of exponential growth to address different types of crises, including the pandemic and the climate crisis. As always, if you like the show, give us a thumbs up and consider subscribing. Now, let's get going with the conversation. This is the Evolution Show. Welcome to the Evolution Show. I'm your host, Johan Landgren. Before we begin, I'd like to extend my deepest gratitude and respect to all those in the medical profession, volunteers, and others that are the real heroes right now. They deserve our help and our support. Together, I think we can come out from this much stronger. The Evolution Show is all about addressing some of the biggest challenges and opportunities of our time. And today, I'm going to take a closer look at the pandemic, the coronavirus crisis. What can we learn going forward? I'm going to look at Sweden, my own country, as well as many others. What do they have in common? What can we learn from each other? And what do we need to do to prevent crisis for the future? I'd like to start with a quote from Professor Albert Bartlett. "The greatest shortcoming of the human race is our inability to understand the exponential function." Professor Bartlett has become quite famous for his numerous presentations explaining exponential growth in an easy way for people to understand. I strongly recommend you check out his presentation on arithmetic, population, and energy. I'll provide a link in the description section below. Professor Bartlett passed away in 2013. But his work and message lives on and has never been more important. So why is it so important to understand exponential growth? Let's start with an example. I'm a beekeeper since 6 years back. As a beekeeper, you learn that the honeybees grow in numbers each year. Each hive reaches a threshold when they need to swarm, which is the bee's way of spreading in nature. Simply a way of survival, to spread the genes. Now, imagine if you start with one hive the first season and double the number of hives you have every year for 10 years. You can then go from 1 hive to 2 hive and to 4 hive and so forth. And by the 5th year, you would have 16 beehives. But look at this graph. By the 7th year, you would have 64 hives. By the 8th year, you would have 128 hives. But by the 10th season, you would have 512 hives. This is an incredible growth. But it's hard to imagine when you start off with only 1 hive. This is exponential growth. Let's take a look at another example. The lesson from this is that when you look at the exponential development, you should not focus on the early numbers. Look at Italy. The first case was the 21st of February. About a month later, the fatality cases had increased to 9,134. In only 1 month's time. This is exponential growth. Okay, let's take another example and look at Sweden. The 26th of March, Sweden had 77 case fatalities and a doubling time of about 3 days. If we extrapolate this development and double the number of cases in Sweden every 3 days, we would reach 78,488 cases in just 1 month. Of course, I'm not saying this will happen, but this is the power of exponential growth. In the early stages, the numbers are growing seemingly slow, but when we extrapolate out this in time, we'll see that the growth can be incredible. The very important lesson here is that every time we're dealing with exponential growth, we should never focus on the early numbers, because in a very short time, the numbers can become gigantic. By looking at this curve, you realize that the measures taken early on in China was not so draconian as they seemed at the time. And now look at the rest of the world. They're following the same pattern, the same development, the same exponential growth. That is why we have to learn from what happened in China. When you look at the number, when you look at the pandemic early on, don't focus on the number. Focus on the growth, the potential growth at hand. I will come back to what happened in China and what lessons could be learned from the measures they took there. Italy has been hit hard by the coronavirus in Europe and is now the epicenter in Europe in terms of spread and case fatalities. And interestingly, there are many similarities between Sweden and Italy. As we have learned during this crisis, the biggest risk factor in terms of fatality or becoming severely ill from the COVID-19 is age. Italy has the second oldest population in the world, which has greatly impacted the number of severe corona cases and the number of fatalities. But Sweden is not far behind, on place 8th in the world. The age groups 65 and above in Sweden are similar, but it's really important to note here that Italy, with 3% more people in this age group, 65 or older, has 1.8 million more people than Sweden, with higher risk of hospitalization, which is a lot. Sweden and Italy both have a very modern healthcare system, and citizens are provided with a universal healthcare covered by public and private healthcare systems. But both countries increasingly are struggling with long waiting times at public hospitals and clinics, while those with private healthcare insurance have much shorter waiting time for most visits to doctors, and in particular surgical operations or advanced treatments. In Sweden, the biggest problem the last couple of years is the lack of medical personnel at the emergency departments, ER, as well as lack of specially trained nurses at many hospitals across the country. A medical doctor at one of Sweden's biggest hospitals, the Academic Hospital in Uppsala, described the waiting time at the ER as the worst in 30 years. This is also my own anecdotal experience. I took a friend to the ER a couple of times the last year and noticed the extremely long waiting time before seeing a doctor, and patients lying in beds in corridors with no separate room and very few physicians and nurses. This was not the case only 15-20 years ago, but we'll soon see when it comes to the bed occupancy rate and the number of intensive care beds, ICUs. In Sweden, the situation is much worse than in most other countries. Here's a graph I made showing hospital bed occupancy rate and hospital beds per 1,000 people. On the left y-axis, we have hospital bed occupancy shown as percentage of total capacity. And on the right y-axis, we have hospital beds per 1,000 population. Here we can see that Sweden really stands out as ill-prepared for this crisis, with among the highest bed occupancy rate in Europe, and indeed the world. Most of the time already at maximum capacity with 100%, only 2 hospital beds per 1,000 people. We can also note that 2 of the countries that had managed the outbreak relatively well, South Korea and Germany, came much prepared. South Korea has almost 6 times the bed capacity as Sweden, and Germany almost 8 times. South Korea's hospital bed occupancy rate is as low as 64%, while Germany has less than 80%, which makes all the difference since it buys time and in the early phase of the outbreak. Also notice that both Italy and Spain came much more prepared in terms of these 2 indicators than, for example, my own country, Sweden. So as you can see, we can start to identify a clear trend here. Not only has Sweden the lowest capacity in terms of hospital beds, and in addition to this, as we already mentioned, Sweden also has among the highest bed occupancy rate in Europe, which means that we have a very low capacity to take in new patients. We also have the lowest capacity when it comes to critical care beds, ICUs. We can also notice that United States have about 6 times the number of ICUs per 100,000 people compared to, for example, Sweden. We used to have in Sweden 900 ICU units on a standby in times of crisis. Today we have 50. We used to have 50 field hospitals ready to be built in times of crisis. Today we have 2. Ventilators are to this war what missiles were to World War II. This is a quote from Andrew Cuomo, governor of New York. If we look at the number of ventilators in United States, China, Italy, Germany, UK, and Sweden, we can see major differences before the outbreak. Before the outbreak, Sweden had only 576 ventilators on a population of 10 million, including only about 50 extra ventilators stored by the military. This makes less than 6 ventilators for every 100,000 people. In Italy, for comparison, there were about 5,000 ventilators before the outbreak, on a population of 60.5 million people, or about 8 ventilators per 1,000 people. 2 more than Sweden. Thankfully, many ventilators have been shipped to Italy and Sweden is working hard to manufacture new ones domestically, and have gained access to more the last couple of weeks. But at the moment, it is likely too few. I'll come back to Sweden and why it's remarkable that Sweden has so few ventilators compared to other countries. We can also see one of the reasons why China has managed quite well when it comes to ventilators. They have the highest number per 100,000 people in the world. United States as a nation also comes relatively well compared to other countries. They have 61 ventilators per 100,000 people. Germany, when it comes to Europe, also have quite a lot of ventilators, 30 ventilators per 100,000 people. If you look at emergency preparedness in Sweden today, it is dominated by loss of memories and a just-in-time system. The millennials, for example, a generation I belong to, in large part this population has never experienced a societal crisis like today, and Sweden is a nation that hasn't experienced war in over 200 years. But we don't have to look back further than 2013. During a couple of weeks in the Stockholm area, there was so much snow on the roads that the transport system didn't work. And at the time I wrote an article together with a doctor where we looked at the emergency preparedness at different kind of medical clinics in the Stockholm area. And we can see that the storage of medical supplies were gone in just a matter of a few days. Because of the heavy snow, the transports to the different medical clinics couldn't get there, and with the just-in-time system not working, patients couldn't get the medicine they needed. During the last couple of years, 2017 and 2018, there's been a number of reports in Sweden pointing to that the lack of storage in terms of medical supplies in Sweden could become critical in times of crisis. As I mentioned before, the number of ICU units in Sweden is very low on a per capita basis. But there is also another problem. We only have 50 stored ICU units in Sweden, or ventilators and so on, for ICUs. This can be built and used by 2 field hospitals that are stored by the military in Sweden. I'll come back to that point later on. There are also no more medical drugs or equipment stored at all in Sweden, more than that we have stored already, of course, at the hospitals. And I also mentioned we have 100% occupancy rate already before the crisis started in Sweden. And of course, we don't have any stored food at all on a national level. We have what's stored, of course, at the different shops and so on and supermarkets around the country. But we don't have a national storage, which we used to have. And Sweden is no oil producer at all, so we import all the fuel we need for the transport sector. We used to have storage. I'll come back to that soon. But we have no storage, basically, other than the 90 days that we are provided to have for the International Energy Agency. that are located in different storage units in Sweden. But that's supposed to be used in times of crisis, and to be distributed among the different OECD countries, and it's not only to be used for Sweden. Now, most of you probably wonder, how can Sweden be so naive and come so unprepared when it comes to the health service and the emergency readiness? To understand this, we have to take a step back, because not too long ago, things were very different in Sweden. About 20 years ago or so, the emergency preparedness in Sweden was on a totally different scale. In fact, Sweden has been identified as perhaps the world-leading country when it comes to emergency preparedness, or we were at this time. The whole society was built and structured to be able to cope in a resilient way with different types of crises, including natural catastrophes, epidemics, war, transport disruptions, and financial crises. We had, for example, national storage of medical supplies for the whole population. At the time, 8 million people. We had, for example, 8 million gas masks, and we had protector industrial capacity for domestic production of medical drugs for the whole population. We had a national pharmacy company that was state-controlled that rotated all the drugs in the different national storage units in order to keep them fresh. So they were never left alone, and they were monitored all the time, so we had the right number for the population. And until early 1990s, we actually had 50 fully equipped field hospitals capable to treat 900 people with ICUs and more than 10,000 standby hospital beds. And the hospital beds, including the ICUs, were prepared to be installed in convertible schools and kindergartens as well. So you had a regular kindergarten or school that could be transformed into ICU units. They had installed different kinds of equipment under the roof in the school and the kindergartens. It was totally amazing. Until the early 90s, we had around 80% bed occupancy rate, which means that we had room to take in more patients on a regular basis, which of course is vital in an early crisis. We also had industrial equipment and commodities that could be used and that was stored if the international supply chains were disrupted in Sweden. And this included not only medical equipment, but also food and fuels, for example. We had a very advanced system where the farmers were rotating and storing grain to supply the whole population for at least 1 year. Many people claim that Sweden's lack of emergency readiness is due to globalization and the just-in-time system. But this is a poor excuse, because if we look at our neighbor, Finland, we can see something very different. Many politicians in Sweden today, and those that were responsible for starting this dismantling of the emergency preparedness system in Sweden, including storage of medical capacity, medical drugs, medical equipment, they argue that due to the globalization and the just-in-time system that came with it, it was a natural consequence that Sweden couldn't stick to the emergency preparedness we had up until the 1990s. But I argue that this is a very irresponsible way of looking at the facts. If we compare to our neighbor, Finland, they took a totally different path. Finland has kept a similar system that Sweden had until the 1990s. Today, Finland have medical supply for the whole population, including medical drugs, fuel, vital industrial commodities and chemicals. They have stored food for the whole population for about 6 to 10 months. Finland also has around 80% of the food production that can be sustained domestically. This can be compared to Sweden, that can be domestically sustained with its own food production with only about 50%. Finland also has a very well-organized civil defense, like the one Sweden used to have. This includes the military, then the whole society. They have the ability to mobilize several 100,000 soldiers, and these are to be used not only for war, but for all kinds of crises, externally and internally. They have a very comprehensive civil defense organizations, or several, of course, civil defense organizations that have regular trainings and exercise with the whole population. There is a constant monitoring of the critical supply chains to Finland to maintain food and industrial security in times of crisis. There is a lot to be learned from Finland, I think not only for Sweden, but for many other countries. You can maintain a national policy where you have a high degree of emergency preparedness in times of crisis. This is not only good for the nation that has this preparedness, it is also a huge help for others that might not have the same degree of emergency preparedness in times of crisis. If you are prepared both individually and nationally, you are able to help others much better. And here I'd like to make a very important point. In the early phase of this pandemic, especially here in Europe, different countries were blaming each other for lack of solidarity. For example, Sweden, that were desperate for medical supply due to this lack of national storage, wanted to import large storage of medical supplies from Germany and France. But they stopped their exports of medical supplies, at least for a short time. And of course, following this, there were huge discussions on solidarity within the European Union. But I don't think you can demand a country to export products of vital medical equipment in a crisis where you don't know if this will be enough for your own population. I think this is just common sense and not a matter of solidarity. It's a matter of survival, in fact. Of course, as this crisis has developed, Germany and France have helped each other out in different ways. For example, France has sent severe cases with COVID-19 to different hospitals in Germany. Now, let's take a closer look at China and the important measures that were taken there. Okay, let's move on to some very important lessons from China. I mentioned early on the importance of understanding the power of exponential growth. If we look at China, early on, there were very few cases, and the reporting was focusing on these few number of cases. But as the development changed in China, people were focusing on all the measures China were taking. For example, China took the decision to quarantine more than 10 million people in the city of Wuhan, which was the epicenter of the outbreak of the COVID-19 or coronavirus. And not long after the spread expanded outside Wuhan, they closed down the whole Hubei province with more than 50 million people. And a lot of countries, including my own, Sweden, looked at this and said, no, we can't do this in other countries. This is extreme measures that can be taken in China. But look at what has happened since then. As the exponential growth of cases, fatalities and so on has developed in other countries, following the same pattern as we saw early on from China, with a few cases in early on, moving on to more and more cases, the measures that have been taken has been very similar to those taken in China. So I think we should take a step back, look at what we can learn from China, and be honest and realize that they took measures that were very efficient and that we can learn from for future pandemics. And I will mention some of them here. What China did, for example, early on was to have dedicated COVID-19 hospitals. This means you had hospitals already built, but where you moved patients away from there that were not COVID-19 cases and focused the stream of cases, of new COVID-19 cases coming in to only be coming to these dedicated COVID-19 hospitals. In this way, of course, you decrease the spread to other patients within the hospital. You can focus your energy and efforts and resources to these hospitals. This was a very smart move, and I've seen many other countries doing the same thing after this. And of course, you saw the construction of new hospitals. And at the time, of course, people said, well, this is extreme. How can you do this in such a short time? And is it really necessary? Well, what happened after this? In several other countries, we see similar patterns. Building new hospitals. Why? Because if you have hospitals, like the dedicated hospitals, you can focus the new cases coming in to these hospitals. In this way, you contain the spread. So if you have spread within the hospital, you only have spread within a hospital that is already dedicated to the coronavirus. You also saw some other really important measures, like transferring resources, including medical staff, from less impacted parts of China to the Hubei province and Wuhan, of course, with equipment from the military deployed, as well as military medical staff. And of course, perhaps the most important thing, aside from quarantining, China had extensive testing. You could identify different clusters, you can identify individuals, regions, parts of the city, or other cities. By identifying the cases, you could focus the efforts and contain the spread as much as possible to Wuhan and the province of Hubei. China also used state-of-the-art technology to actively monitor the spread of the cases. But they also used this technology to update the different hospitals and doctors on what is happening. So for example, if you needed to change the policies and update the different hospital on the number of cases they could expect coming in, you could do that live all the time and simultaneously send this information out to all the hospitals within days. Of course, there are things to be learned from that were negative in China, but China really stepped up their efforts. Within a couple of weeks, they started the domestic production of medical supplies and equipment for example, their medical staff. And they also updated the information on a regular basis, so the medical staff learned how to protect themselves. Okay, now we really have to look closer at why it is so important to use extensive testing, because there are a lot of misconceptions surrounding this matter. A new study in the highly respected scientific journal Science underlines why we still need extensive testing to save lives and slow the spread. The study showed that the majority of the spread of the coronavirus spread from mild or asymptomatic cases. The study was conducted by researchers at the Columbia University, Hong Kong and Beijing and others, and they analyzed the course of the epidemic in 375 Chinese cities between the 10th of January, when the epidemic took off, to the 23rd of January, when containment measures such as travel restrictions were imposed. Here's a quote summarizing the study in the Journal of Science from an article in New Scientist. The study concluded that 86% of the cases were undocumented, that is, asymptomatic, or had only very mild symptoms. The researchers also analyzed case data from foreign nationals who were evacuated from the city of Wuhan, where the first cases were seen, and found a similar proportion of asymptomatic or very mild cases. Such undocumented cases are still contagious, and the study found them to be the source of most of the virus spread in China before the restrictions came in. Even though these people were only 55% as contagious as people with symptoms, the study found that they were the source of 79% of further infections due to there being more of them and the higher likelihood that they were out and about. So the conclusions from this is we really need to test. We need to test early on in the phase of a pandemic, but also during the pandemic when we want to bend the curve, or on the way down the so-called curve of new cases. I will provide a link to the article in New Scientist, as well of course as the study in Science, in the description sections below. Okay, let's summarize the conclusions. The most important lesson we can learn from this pandemic to prepare for future crises is that unforeseen events, or so-called black swans, always will surprise us, as they almost never are the same. The next black swan may, for example, affect our access to food, and that means we cannot only build a huge storage of medical supplies, we also need to have a storage of food for our population on a national level that can be distributed in times of prolonged crisis, when supply chains from other countries may be disrupted, for example. This is just common sense and an insurance policy to build a resilient society. There are many important lessons to be learned from a country like Sweden that has moved from being a world leader in terms of emergency readiness to a country that has totally dismantled the emergency and preparedness system, including the medical health system. We need to wake up and learn from these mistakes. One thing we can identify is that there are negative externalities like a pandemic, like climate crisis, that cannot be handled by the markets. The market operates to maximize profits. And what happened in Sweden was that we dismantled the responsibility from the state to be able to handle different kinds of emergency crises. The private sector cannot prepare for a crisis, nor the state alone, but we cannot move the responsibility of storing essential medical supplies, food and medical equipment to the private sector, simply because they are operating in an open market, where storage costs money. And here the state has to move in to take responsibility of both storing and monitoring the storage on a regular basis, which we can see is working in countries like Finland. Future crises may not be pandemics. They may also involve natural disasters or war. So we also need to store food for the whole population. It is fully possible to do that. We need to remember that in a free market, actors work towards improved efficiency in a just-in-time transport system to maximize short-term profit. Regardless of the responsibility between the private sector and the state, we have to be very transparent when we talk to the public of what is expected of the citizens in times of crisis. How much food should we have stored at home, for example? How much help can we expect to have from the state in times of crisis? And what can we do to help each other out in times of crisis? The transparency has been lacking in Sweden for a long time. People still expect the state to step in, for example, in the situation that like we have today in the pandemic. People just expect the state to have the medical equipment, the medical drugs, and so on. But clearly we can see that they don't have this. So how do we prepare for a future? Should we, for example, divide the responsibility between the families, the society, and the individuals, and the state? And to have a certain degree of storage, for example, much larger than we have today in terms of medical supplies, food, and drugs on a national level. Solidarity between countries, solidarity between people and hospitals, etc., is relying on the capacity we have on the different levels. If we don't have medical equipment, if we don't have food, and if we are not transparent about the roles we have in terms of responsibility, we cannot expect people to have solidarity towards each other. It simply won't work. I want to send two really important messages here. We need to prepare for different types of emergencies, and we need to do this together. There is hope for Sweden and the rest of the world for the future, because the society, individuals, companies, and organizations can manage almost everything when organized and prepared. And we will survive this crisis. But to come out stronger, we need to be serious in preparing for the future. Crisis is a natural occurrence, but how we prepare is up to us. That's all for today. Thanks for watching. As always, we appreciate your feedback. Was it good or bad? If you want to see the episode as soon as they come out, consider subscribing. In the next episode, I'll be with you from my garden with a surprise. I hope to see you then.